province. We begin tonight with details of the sweeping changes Premier Danielle Smith has announced for kids seeking gender-affirming care in our province. Smith is defending her plan to ban hormonal treatment, puberty blockers, and surgery for anyone 15 and under. Her new policy also requires parents to be notified of name or pronoun changes in school and to okay sex education classes. Bill McFarland reports.
In the past, Danielle Smith has urged support and choice for the trans community.
Very complicated family matters, very personal decisions, and it's been my hope from the beginning that we wouldn't politicize this.
Her critics now say that's exactly what has happened with sweeping new policy that would impact access to time-sensitive therapies and require parents to be informed of name or pronoun changes in school.
I think that we've struck a reasonable balance.
According to census data, there are nearly 12,500 transgender and non-binary Albertans. Now hormone therapies, which include puberty blockers, will be banned for anyone under 15, no matter the wishes of the patients, medical teams, or parents.
The best use is early in puberty, which is well under age 15.
Make sure that children do not prematurely make decisions that are going to be irreversible and affect their ability to have sex and affect their ability to have children.
Most of the changes we make are reversible. There are very few that are truly irreversible.
The new policy also bans surgeries in anyone under 18, which is largely already the case, say doctors. The province says about 100 Albertans over 18 years old are approved for gender surgeries each year. We did not receive any number for minors.
We have never had bottom surgery done under 18, so the notion that we have a rule that we can't do it, it doesn't change anything.
The changes also impact sex ed in schools. Parents can already opt out, but now will have to opt in with written permission.
Now every parent, every student has to bring this form in to say that it's okay for them to do that. But that's going to put a huge burden on schools, teachers, school leaders.
Some groups have already promised legal action.
Most of us would be surprised if large parts of this policy isn't immediately challenged on various grounds.
All right, Bill joins us now. Bill, the Premier also said she'll look at transgender female athletes competing in women's sports. So how common is this?
Well, we were only able to come up with a single example where it made a difference in an outcome of anything. We talked to ATA as well, and they said that they're aware of some instances, but they say it's relatively uncommon. We heard the same thing from Rocky Mountain Lacrosse League, which represents about 1,500 players. They say it's come up, but it hasn't been a big thing. What the problem is here, though, is that some of these sports organizations rely on both federal and provincial funding. There are contradictory rules coming into effect here on this, so that's going to put some of that funding for them potentially in jeopardy. The province says they're going to be looking at this sweeping new set of policies. They'll be introducing it in the fall session for what's required for legislation and ministerial orders in the meantime. Tara.
Okay, Bill, thank you for that. So these new policies are garnering both criticism and support across the country. So let's bring in Tim Brooke now. Tim, the critics are arguing that consultation never really happened here.
That's right, Tara, and they say that if the province here would have just stopped and actually talked to Albertans, then this entire announcement really probably wouldn't be necessary. Instead, today, Danielle Smith drawing the ire of advocates and other governments, and she has at least 2 groups right now threatening to bring this new policy to courts. Jasper Servo says he was 8 when he realized he wasn't born into the right body. At 11, he told his parents.
Well, he's just like any other teenager. He's smart and funny.
Now 13, Jasper is facing an arduous process. He's in a queue to receive gender-affirming health care, but the almost 3-year wait has been incredibly taxing. Under new policy, that wait is going to get longer.
I shouldn't have to wait to be who I am. That's pretty simple.
A fresh concern amongst those with lived experience is that new provincial policy will only politicize their feelings and extend an already difficult and awkward period.
We have the choice to teach our youth that they are loved unconditionally, or we have the choice to teach shame.
Multiple federal ministers feel the same way. They say this decision targets a vulnerable population for political points.
If there's ever been a time in this century for people to stand up for the kind of Canada and the kind of Alberta we want, it's today.
2 groups have already promised to challenge the policy in courts. The federal government won't commit to that without seeing final legislation, though the health minister does plan to meet with his provincial counterparts soon.
Danielle Smith has not reasonably consulted with the people who are most impacted by this.
But not everyone is a critic. Many UCP supporters have been asking the province for more parental rights for years. In fact, the party voted in favor of them at its last general meeting.
We had some concerns about consent and information, and she's addressed some of that in a fairly spectacular fashion.
Further details are expected soon, but the Premier admits legislation could take up to 6 months to finalize. Tim Brooke, CTV News, Calgary.